talk conjunctival edema. I saw a patient today who's about a week out from surgery. We did a lot. We also did a lower blepharoplasty where I took out some of the fat here that had begun to pooch forward. And she has a little bit of swelling and redness along the eyeball. Most of her swelling is laterally, so kind of the outer corner of the eye, and it's making her kind of tear. It's a little bit tender. This is not overly concerning after a lower blepharoplasty as things are healing and the swelling is coming down. Sometimes the outside of the eye, that kind of clear jelly lining, can get inflamed and irritated. What I told her is that keeping it simple, doing little things here and there, can often dramatically improve that area very quickly. When you get an eyelash in your eye and it's irritated, what is the first thing you do? You close your eye. That's what makes it feel better. So I told her, honestly, this afternoon and this evening, the most comforting thing for that eye irritation is actually going to be keeping it shut. You can kind of lay a little washcloth over it, or sometimes we'll even apply a little bit of tape just to keep the eye shut so that you don't have to focus on keeping the eye shut. Some saline drops, which saline is just salt water. That's the same kind of pH and tonicity as the tears, so it's less irritating than water. And then I'm going to see her back tomorrow, make sure everything's getting a little bit better. If for some reason she's a little bit worse tomorrow, or if something else has happened overnight, then we can always start a medicated, like steroid eye drop, which can also help with resolution of conjunctival edema. But most oftentimes we don't have to jump to that.